Good morning, everyone. Thanks very much for joining us. We appreciate it. The fall-winter coronavirus surge that was predicted is now in full swing, and all the debates we had about restrictions and closures last spring have also come roaring back with a vengeance. Here to give us a candid perspective from the municipal level is Somerville Mayor Joe Curtatone, part of a consortium of city and town officials who've been advocating for tougher measures to stop community spread of the virus. Mayor, good morning. Welcome.
Thanks, John. Good morning.
So in the Globe last week, two local health experts wrote, quote, "Governor Charlie Baker needs to do more to reduce infections. His weak actions in the face of the spiking cases, against which he announced the lightest of new restrictions on Tuesday, are inexcusable," end quote. Do you agree with that?
No, I agree. Yeah, we, as experts, have warned us. We're in the, to say we're in the crucible is an understatement. We have already crossed the threshold into the darkest part of this pandemic. We're being overwhelmed by cases. Our healthcare system's showing signs of strain. And you know what, John? People are dying, becoming seriously ill. And how much death are we willing to tolerate? And we need to take deliberate, decisive, definitive action to reverse the trend of community transmission if we want to save lives and if we want to get our economy back on track and get kids back in school.
So what do you want to see done?
Well, I speak for many of my colleagues, not just around the region, around the Commonwealth, is, look, we want to work with the governor. This is not a fight against the governor, the legislature, the business community, or parents who want to send their kids to school. We're fighting the pandemic. To do that, we need to do that collectively. We need definitive action. Many of us have called for a rollback of the reopening plan to what is defined as an adjusted 2.1. But basically, those indoor activities that health experts, epidemiologists have said pose a high risk. They are indoor dining. They are health and fitness centers and others. We need to do everything to reduce the risk and not only depend on where the contact tracing efforts are telling us where the cases come from, because we all recognize the contact tracing effort here in the Commonwealth has fallen short. We know that more than a third of the contacts are not being reached in the first 24 hours. That is a critical time. And we know that more than 25% of the contacts are not being reached at all. It speaks to how there's a big void there. And we can't afford time at this point, John. We have no time. We need to take action. We need to do it together. And we also then need to support the businesses and employees that are going to be impacted by that action with direct financial support.
Well, we're approaching some of the most sacred days in the Christian calendar. What about church services? Would you like to see those restricted or banned?
We need to restrict and curtail back and limit and stop any activity that contributes to community spread. At the end of the day, this is about saving life. If we value life as a society, and we're guided by what we claim is our moral compass, we will do that. But we will do that and support one another. My mother aches to go back to Mass. I'm a Catholic, and I attend with my wife, and we haven't been. I was recently at a dedication, but other than that, I haven't been. So many of us haven't even had the opportunity to go and grieve with family and friends who've lost a loved one in these last several months. But we can't exchange. There's no trade-off. There's no argument of balance between the economy, these activities, these conveniences that are important for our life, and these things that are important to our faith in exchange for human life. Human life and saving people's lives and avoiding serious illness should be at the forefront, one. And two, we need to support everyone else along the way.
So you'd like the churches to shut?
If that's what the science and the data is showing, I'm not so sure they have to shut. And if they're saying it should be curtailed back, I mean, many of us never went to where the governor went to at 3.2. Some of them didn't even go to the fullest extent of 3.1. We had a hybrid version. And many of those activities, like church activities, we had limits on that. So we should follow the science and the data. We should not be impulsive on this. But we know what has to be done. And there's no buying time, for example, we shouldn't be taking the approach, let's just get to Christmas and help the retailers and the restaurants. This Christmas and Hanukkah, important times of year for worship, we should get everybody in church. We're overwhelmed right now, John, and we might be too late in many cases, but we still can save lives. And we need to do that by working together. We need to make sacrifice if we want to avoid serious illness, collapse of our healthcare system, and loss of further human life.